Good evening. Thank you. I'm Paul Erwin. I have the privilege of serving as Dean of the School of Public Health here at UAB, and it's my pleasure to welcome you to the School of Public Health and to our special orientation event for the public's health. Before I go any further, I want to thank in particular our Office of Student and Academic Services, the OSAS staff who are here, as well as our communications and marketing people and other folks in the office of the Dean. Thank you for all your work in putting this together. This event actually grew out of discussions with several students and alums about developing an event for all incoming students to introduce you to the school and to your classmates, and as a way to create a sense of community. Y'all come on in and please find a seat. An orientation event like this one is unique among schools and programs of public health in the U.S. Our School of Public Health event was also inspired by the white coat ceremony, the induction ceremonies that are held in medical schools across the country for incoming medical students. We want our own public health induction ceremony to be clearly tied to the values to which we all aspire as public health professionals, whether in academia, practice, or other setting. Those values and the internal ethic of public health set us apart from medical schools and other health professions. We are elated to bring this event to Vulcan once again. When I was a medical student here a lifetime ago, Vulcan's torch was a light. It usually shone green unless there was a traffic fatality that day in Birmingham, in which case it was red. That actually had a way of connecting residents across the city. We each bore some part of someone's loss. That connection today for me is the promise and hope of a magic city icon that serves as a welcoming beacon for all of us. We are all forged in ways that are both common and unique, but we comprise one community of public health. And tonight we celebrate this community in welcoming our newest members, our new students. Again, those of you who are standing in the back, if you want to come in and find a seat, please do. We are joined this afternoon by department chairs, associate and assistant deans, other faculty, staff, and alumni. Without this community of scholars, there would be no School of Public Health and no inquiry into health and well-being of our citizens. We are in their debt for the myriad of daily contributions they make. For the Public's Health is our opportunity to introduce you to public health as a community of scholars and professionals dedicated to improving the health and well-being of everyone through research, education, and service. As a class, you are about to embark on a journey unlike any educational experience on this campus. Your classmates are the most diverse at UAB. You will have the opportunity to learn from each other as you explore the complexities of healthy people, from their genetics to their neighborhoods. Your classroom will become a shared experience with fellow students who come from a broad range of social and cultural backgrounds that will enrich, inform, and guide your studies. You will have the opportunity to grapple with the most common and complex problems facing our communities, from those we live in to those across the planet. It is now my honor to introduce our speaker this afternoon, Dr. Mazi Rasulnia. Mazi is a highly accomplished entrepreneur with expertise at the intersection of healthcare policy, research, and business. Mazi started his business career at Outcomes LLC, a provider of assessment and evaluation services within the United States and globally, to become one of the largest biopharmaceutical and medical communications companies. He served on the executive team and as president of Outcomes LLC from 2003 to 2013. In 2014, Mazi founded PAC Health, a digital health coaching company that focuses on providing personalized education, tools, and support for patients with chronic conditions. PAC Health's clients include biopharmaceutical companies, payers, employers, and health systems. The exponential growth of PAC Health led it to be acquired by Quest Diagnostics in February 2022. Currently, Mazi serves as a co-founder and partner at Taurus Health, a boutique healthcare consulting company supporting the commercialization of AI and digital health solutions, as well as strategy, investment, and scouting services for healthcare-oriented investment firms. Mazi completed his undergraduate degree in biology at the College of William and Mary, after which he went on to complete his master's in public health with our school, his MBA, and his PhD at the University of Alabama at Birmingham, as well as completing a fellowship at the Center for Outcomes and Effectiveness Research and Education. Mazi has authored over 85 publications across a variety of topics in the healthcare industry. Mazi, we are so proud of everything that you have accomplished. You are a model graduate, and we are so glad that you have taken time out of your busy day to work, to share some words of wisdom with us. So welcome, Mazi Rasulnia.
Thank you, Paul, for that gracious introduction. I'm deeply appreciative to be here with you today to kind of share the profound impact that my education, and specifically the School of Public Health, has had on my career. And as Paul shared a bit, I'll kind of get into some of the details of how that applied to the private sector, because most folks who join the School of Public Health tend to go into the public sector. So I think that's why I was called on today to provide some of my words. But let me give you a bit about my journey. I'm going to skip a few decades as I go through this. But my family immigrated to the United States in 1986 when I was 7. We lived in Nashville, Tennessee. My mom was a successful business owner, and my dad was a professor at Vanderbilt University. So that academic gene was kind of in there to pursue a higher degree. And he's always encouraged both my brother, who also graduated with a master's at the School of Public Health and a PhD from the University of Alabama, to do whatever we want to do, but get the highest degree possible in whatever you want to do. I embarked on my educational career at the College of William and Mary on a track scholarship. Again, don't look like it today, but I do used to run middle distance, and majored in biology and minored in chemistry. And as any Middle Eastern parent would say, when are you going to become a doctor? And I tended not to want to go and touch people and blood and urine and everything else. And I was inspired by my brother, who was finishing his degree here, to come down to UAB for the dual track program that UAB actually at that point was a rare find, an MPH and an MBA. And so I shifted focus, came down here to UAB, and during my MPH program, I focused on healthcare policy, which will have an impact later in kind of the career pursuit that I had. Subsequently, after my master's degree, I was nudged by Pete Ginter, I don't know if he's in the room, and Jack Duncan and Sanjay Singh. Sanjay was in the School of Business, and so was Jack, but Pete was in the School of Public Health. And I think they probably saw that one day I may want to become a teacher, but they said, go get your PhD. I think you're not ready for the real world yet, so continue getting an education. And so I eventually got my PhD here across the school from School of Public Health and Health Services Research. And from there, I joined my first startup. That was called CE Outcomes. We sold to a lot of life sciences companies, really taking a lot of the practices that we learned, nominal group techniques, surveys, how to write particular case studies, and applied them to the private sector. And at that point, a lot of pharmaceutical companies wanted to know, are physicians learning anything that we're putting out there? There's a lot of evidence that we generate. Is it sticking? Is it translating into effective care? And I ran that company for a decade and then realized that there's a bigger opportunity coming, and came under Obamacare. So in 2010-ish, when Obamacare was finally passed and people were starting to kind of figure it out, everything shifted in the world of healthcare to patient-centered care, right? We've all heard that term. How do we put the patient in the center and kind of think through that experience? And so we launched a company at that point called Pack Health. And really the focus of Pack Health was to, as Paul alluded to, really help people who have chronic illnesses. But I'm going to come back to that and share really the post-journey perspective, or the post my PhD and MPH, a brief history of really why I think where you are today, where you guys are about to embark in, is really an essential degree, and what you can do with that degree. So first and foremost, there's probably never been a more pivotal time to be in public health than today. We all just survived a global pandemic, and that pandemic showed us what good public health policy looks like, and infrastructure and response, versus what bad ones look like. And I think from that perspective, we learned that public health is very essential to our overall healthcare system. Typically, it's been kind of like the redheaded stepchild, and we always look at hospitals and the medical side. But we learned that, oh my goodness, we need public health to actually survive as a society. The second thing I wanted to kind of share with you guys is the explosion of data and technology that's out there. So as Paul alluded to now, that I can kind of do whatever I want to, which is always a good position to be in. I've been investing and learning a lot in AI. And while it's, you hear all sides of the story of is it good, is it bad, there's a lot of potential if you use it correctly. And I'm not saying go out there and have your papers written by ChatGPT. But more correctly, from the perspective of how do you scale public health differently. And I'll share some examples of companies that have come by. There's a company that I've been working with recently that allows clinicians now to take millions and millions and millions of evidence that's out there and really distill it down within 70 milliseconds, and exactly say, this is what the recommended guidelines are. This is exactly what the newest data says that you should do with a patient or a population. Before that, it took 3 to 4 months for a hospital to develop a protocol based on evidence. Now it takes less than 7 days. And it's probably going to get down to 7 minutes at some point. But it's a great use of application of AI, public health, evidence to really advance population health. The second is a company that we've been working with a bit around social listening. So I was just mentioning earlier in the hallway how, when I was a graduate student, we do, again, a lot of focus groups and surveys and primary data collection and, getting people to respond, especially in today's day and age where everybody has text and email and spam, is really difficult. Well, there's something called social media and Google, and people now, spend a lot of time on these platforms sharing a lot of health information. In fact, 22% of all Google-related now searches is related to health. The next largest, is like 2% of all searches is related to another topic. And so there is a great opportunity to be able to scrape that information, and people tend to be very honest and open, surprisingly, shockingly, on the worldwide internet there. And they share a lot of experiences about if a drug has been working, or their experience going to the doctor, or what their neighborhood is safe or not safe. And there's a lot of opportunity to scrape that data. So we've been working with an application where it's been used a lot in the retail setting, where Coca-Cola and Estee Lauder and everybody else tries to find out what your next new trends are, and looking at it to develop public health campaigns on mass scale. So things around mobilizing things and attitudes around climate change to COVID hesitancy, for example, vaccination hesitancy. So there's a great opportunity to really harness that. The third thing I would kind of focus on is the multidisciplinary nature of the degree that you're about to get. It is a degree that I think will help kind of intersect data, technology, and human behavior, which can be applied to almost any field that at least I've come across, whether it's finance later in life, or CDC, and you're working at the CDC, and how do you get people to adopt and get the message out. There's a lot of opportunities to kind of learn those three things in a degree like an MPH degree. So for me, I took those skills, I took the mentorship and the network that was graciously provided to me in this school, and established PAC Health. And again, the mission there was to really support people who had chronic illnesses. And we did this through a lot of different ways. We had to learn the skills that were taught to us in health behavior, around building trust, and how do you get people through the various stages of change. If anybody is not in that class yet, you will be, and it's a good class. If you still offer it, Paul, I don't know. We learned how to help people break down their complex goals. Like when you go to a doctor's office, they tell you, Mazi, go drink water, exercise, diet, and come back and see me in 3 months. And you go home, you're overwhelmed. And so we help them break it down into SMART goals, specific, measurable, actionable, relevant, timely. We leveraged a lot of the predictive models that now are harnessing vast amount of data around human behavior. So how do you create good nudges to get people reminded or get them more accountable to do the next thing? Along the way, we learned that this does not have to be delivered by clinicians, doesn't have to be delivered by nurses, doctors, pharmacists, that we can recruit out of this school, recruit out of a lot of the disciplines that are on campus, and train people on these protocols and have them build empathetic relationships with patients to get them to do the right thing. So I would say that we've been very, this class and the whole school of public health has been great recruitment for my previous company. And so I thank you for that too, Paul, as you've been pouring out great graduates. Simultaneously, my policy background started to play as we were developing the company, in that we figured out how to get this paid for by insurance companies. And that takes a lot of time and effort to understand coding and alignment to the complex system that we've created in healthcare around policy and reimbursement. So I used to have great conversations with Pete around this, around, how do we get something like this paid for by Blue Cross of Alabama, for example. So as you can kind of tell from just my journey alone, I firmly believe that the multidisciplinary foundation that I received through the education here at School of Public Health really helped my startup. Otherwise, I think it would have been belly up and I would have joined the 90% of startups that typically fail. And the grasp of epi, health behavior, statistics, strategy, technology, all of those come into play if you all decide to move away from the public sector to the private sector and build your own next company. This degree is very valuable in having those conversations. So in February 2022, we successfully exited to Quest Diagnostics. They had a lot of money during COVID and they needed to spend it. And we said, why not us? And so we now have integrated our product with the diagnostics that they provide. So if you go to a Quest Center and you get your blood work done and it suggests you have high cholesterol, you can now enroll into one of our coaching programs, and we can then help you navigate and keep accountable for some of the lifestyle changes that you have. So we're in all 50 states. The company's still in Birmingham, Alabama, which was something we negotiated on and said you have to keep it in Birmingham. We've got a great university, got several great schools that have a lot of talent. And honestly, I think, we're in the position where the patients are here, right? Unfortunately, Alabama is typically ranked at the bottom of most chronic illnesses, and so why not start with our home state and try to improve that? So post-acquisition, as Paul shared a little bit, my focus has been on investing, mentoring, and advocating for the next generation of entrepreneurs in Birmingham, but also in the Southeast specifically. So we've made some investments in some of these companies, not all AI related, but various degrees of technologies that are out there. And what I would say in conclusion, to kind of leave this for you guys, I think your time in the School of Public Health isn't just an education. And if I had to do it all over again, I would do some things differently and really take it in a serious light that this is an opportunity for you guys to embrace risk, to solve some very complex problems that we face as society when it comes to public health, especially with the communication of public health initiatives. It can get very distorted out there with the media. And I would cultivate as many relationships as you can. Paul just shared the chairs and the faculty that are here. These individuals have spent their careers learning and want to share those learnings. And if you can, before school, during school, and once you graduate, stay connected, because it's a golden opportunity to be able to have access to some of the bright minds in public health here. Good luck in your journey as well, and wishing you all the success. Thank you.
Mazi, thank you so much for your words, for all the work that you're doing. And students, one of the things that we wanted purposefully for you to see in Mazi and hearing some of his story is the incredible breadth of possibilities that are before you. You can do, as Mazi mentioned, you can do many, many things. It is really limitless what you can do with your public health education. All right, students, so you picked up one of these as you came in. And on one side, of course, is the pen, your public health pen. But on the other side is a declaration of commitment to public health. So we'll recite the declaration of commitment to public health, which is something that students and faculty and staff wrote together. So students, are you ready to recite this? The Declaration of Commitment to Public Health. Please join me. We, the incoming students of the UAB School of Public Health, hold sacred our duty to safeguard the health of our community, affirm our beliefs as we embark together on this important journey in our training. We'll dedicate our time and talents to the preservation of public wellness through scholarship, education, and service. By declaring our beliefs, we affirm our commitment as students, as advocates, and as citizens to work in partnership with the women, men, and children of our community in order to protect the common health, the common rights, and the common good. We believe that every member of our community is valuable. We believe that every member of our community should have access to health care, health education, and preventive services. We believe that as students of public health, we bear a duty to protect our community from suffering, and therefore today we begin the training necessary to provide that protection. We believe that our efforts can only succeed if they are undertaken in partnership with those whom we endeavor to serve. We believe in innovation and embracing change. We believe in forging alliances and consensus. We believe that the scope of our efforts cannot be restricted by time or geography. and we believe that the obligations to which we pledge ourselves today will endure long after we have finished our training. It is upon these beliefs that we undertake our education, understanding that we work not only to better ourselves, but for the betterment of the communities we serve. We are the students of the UAB School of Public Health. Well, thank you for this. In case any of you were wondering, this is not all the new students that we have. Of course, some students are online and not going to be here in person. Again, I want to thank all of you for attending this special event where we're able to reflect on the meaning of public health as you begin your public health degree program. We also want to encourage you to show off your pen. So be sure to take a selfie and post it on social media, tagging the School of Public Health. Tell us what you're most excited about in starting your career in public health. We'd love to see you representing the school at home. As we close, I want to express again my appreciation to the School of Public Health staff who have planned and volunteered their time and energy to make tonight's induction ceremony a success. If you planned and or volunteered your time, please raise your hand to identify yourself. All you folks in the Office of Student and Academic Services and other folks, they're back there. Thank y'all. I think of our collective efforts to fulfill the mission of public health, which is fulfilling society's interest in assuring conditions in which people can be healthy, as equivalent to a public health moonshot. In 1962, when announcing the goal of landing humans on the moon and returning them safely to the U.S., President John F. Kennedy said, "We choose to go to the moon in this decade and do the other things, not because they are easy, but because they are hard. Because that goal will serve to organize and measure the best of our energies and skills, because that challenge is one that we are willing to accept, one we are unwilling to postpone, and one which we intend to win." In the School of Public Health, we ask you to choose to matter, to be somebody, and make a difference, and become a part of this new moonshot. I look forward to traveling with you. Thank you again for being with us tonight. So goodbye for now, but the rest of this event is for you to get acquainted with your colleagues, as well as the faculty and staff that help support your educational goals. And I look forward to speaking with many of you soon. So thank you for being here.